Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. One of the questions I get as an orthopedic surgeon so often when, unfortunately, you see a patient and he or she probably could benefit from surgery, may absolutely have to have surgery. One of the questions we get, and I get a lot, is, do I have to have it now, or can I wait until the end of a season, or wait until this big project at work is done, or wait until Christmas break or the end of the spring semester if you're a student? And it's a terrific question. There are a number of injuries that need to be fixed surgically right away, and then some that are more elective. And so in this Ask Dr. Geyer video, I address that question: do I need to have surgery now, or can it wait, for a very common injury if you're a baseball pitcher, and that's Tommy John surgery. Okay, Erik asks, I have a complete tear of the UCL, that's the ulnar collateral ligament in the elbow. It occurred 2 years ago. Originally, I didn't plan on getting surgery because I didn't think I'd play baseball any longer. I've reevaluated that decision and I plan on getting surgery if it's affordable. My question is there more damage I can do to the elbow if I play or wait any longer before getting the surgery? Would it make the surgery more difficult or less likely to be successful? That's a terrific question. And before I talk about specifically Tommy John surgeries, let me address that concept, because there are a number of surgeries that probably ought to be fixed right away. If a fracture is displaced, it needs to be lined up and then held in place with hardware. That should probably be done certainly in the first couple of weeks, if not sooner, before that fracture starts to heal in a bad position. If it's a tendon rupture that doesn't typically heal well without surgery, like a patella tendon rupture or a quadriceps tendon rupture in the knee, that probably ought to be done within the first couple of weeks too, before the muscle atrophies and the tendon scars down and it can't be reattached at all. Now, there's some surgeries that you can do down the road, but you increase the risk of secondary damage. An ACL tear is a great example of that in the knee, where if the knee's unstable, the ACL is the ligament in the center of the knee that helps to stabilize the knee. So if you have an ACL tear and your knee's buckling when you go to land from a jump or turn and cut and pivot on it, you could do more damage to your knee each time the knee gives out. You could damage the meniscus, you could damage the articular cartilage, and some of those things are problems that lead to long-term wear and tear changes. Now, this is a little different with the Tommy John injury. That's a ligament of the ulnar collateral ligament on the inside of the elbow, and it's involved in stabilizing the elbow against or during valgus stress, when pitchers basically do the throwing motion. And it wears out over months and months and seasons, and really over the course of a career. Now, a pitcher that tears his ulnar collateral ligament, or it could be a football quarterback or a high-level tennis player with serves, but if you're not planning on doing that sport anymore, you probably don't need to have surgery. Most of us don't use the ulnar collateral ligament in what we normally do in our daily lives. But if you do some repetitive overhead motion, it can be hard without that ligament. A baseball pitcher might be able to keep playing, but he might not be able to locate his pitches well, or he might not be able to get the same velocity on it, and so he can't perform to the level that he really wants to. And non-operative treatment is pretty unreliable for that injury. About a 50% chance of returning to the same level of pitching without surgery, so it can be worth a try, but a lot of times people have surgery because they can't compete, they can't pitch at the level they want to. Now, I don't think there's as much of a risk if you do try to wait and have surgery down the road. I don't think there's that much of a risk of doing further damage. I guess in theory, maybe you wear out a little bit the cartilage on the outside of your elbow, but I don't think that's as big of a problem potentially, as you just can't pitch, you can't locate your pitches as well, maybe you lose a little velocity and zip on the ball. You can't get back to that same level that you were before the injury as reliably without surgery. So most people are like, you know what, I can't do it at the level I want, I'm gonna go ahead and have surgery. Now, have you suffered a Tommy John injury or had Tommy John surgery? And I'd love to hear if you have thoughts on this. Did you have it right away, or did you wait till the end of a season, or did you wait a year or two? And what advice, if you're a doctor or a coach athletic trainer or physical therapist, what advice would you give a baseball pitcher that's debating about when to have surgery now? I'd love to hear your thoughts. So below this video, leave your thoughts in the comment section. I'd love to read them, and I'll try to respond with my thoughts to what you have to say as well. But I would really love to hear what you think. And if you have friends or maybe a family member that has suffered this elbow injury and needs Tommy John surgery, or maybe is recovering from Tommy John surgery, I'd really appreciate if you'd share this video with him or her so that hopefully this video can help and provide information and education for that person. If you like videos like this and want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. I record 1 or 2 of these videos a week, and I would love to deliver those to you automatically so they can be helpful. And last, I share a number of resources about staying healthy in sports and exercise and performing your best in whatever it is you like to do. And I only share those resources free, of course, but by email. So go to my website, drdavidgeyer.com, and click at the top of the page. You enter your name and your email address. I send you a free ebook on injury prevention for all sorts of athletes, and you'll get resources on a regular basis that I only share by email. Thank you so much for watching. I hope this video was helpful, and I look forward to seeing you right here in our next Ask Dr. Geyer video.